happy wherever you are, and thank you so much for joining me. I want to take this opportunity to talk to us again. This is another episode, Tuesday class job market episode, I think around 40, and this one goes back to the answering the question that I got from one of the students in one of the health school sciences, and she wanted to know more about nursing, because I think she watched, there is a clip I did some months ago about the nursing, and I just mentioned some of the 11 great diploma courses that are doing better in the market than the degree courses. It was like an optional, whereby instead of sometimes rushing for the degree, because degree sounds status, and in social status is put you at a par level. But now when you look at the job market, you get that some of the diploma courses are doing better than the degree courses. So that was the main thing, or the main aim of running that episode. Now, from that question, she wanted to know more about the nursing, the details. What is so good about the nursing? What are the reasons as to why nursing should be one of the options? Because I think nursing was about number 5 or in the top chart, or out of that. So today I'm here to give you more details about the nursing. It's a kind of research that I've done, and I've done a lot of readings about it. I've done a lot of research. I've have a sit on talk with most of my friends, especially where I am here. I've talked to, 2 days ago I was talking to one of my friends. She's a nurse, and I was trying to ask her what are some of the benefits as to why somebody can diverge from a normal course maybe to nursing, or are there some options by which we can upgrade the nursing course? Because most of people just understand that once you do a diploma course, maybe there's no leeway to improve or to further education on that. I'm here to answer such questions. And then also, she really wanted to know whether nursing is a well-paying job. I will tell you right away, yes it is. Especially according to the researches that I've done, it is a well-paying job. But in this course, or in this episode, I'll analyze for you some of the top nurse courses, because nurse is just a general health science, but under it we have different types of nurses. It's like engineering. Inside it we have different types of engineering courses. So this one also makes a call to any individual who is either at school, or the student who are still learning, or the fresh graduates. What are you supposed to do after getting your degree and all that? So please stay with me, understand whatever I'm going to bring forward. If it is good for you, please don't hesitate to share. Please share. And thank you for those who have subscribe to my channel. That's a very wonderful support. Please subscribe to my channel, and then mark, that is my YouTube channel. Subscribe, like my content, share my content, comment, post up there the questions. For direct inbox, WhatsApp +254 71122 3525. For the email, andedomark@yahoo.com. Facebook page, Common Sense Isn't Common. Then Facebook account, Andedomark. All those are social platforms where we are supposed to intermeet and talk and share a lot of things that are possible. So still, I'm your tutor Mark, and I'm very well diverse this time round, at least to bring you the better episodes in this nursing course. Now, what is nursing in short? Generally, we can say that this is a profession within the health sector, whereby individuals are doing health courses, health sciences, with an aim of offering that passionate care, or maybe doing research in health diseases to help individuals, to help families, to help a community, or maybe international community, with an aim of either reducing, protecting, or maybe learning, teaching people about the impact or the effect of diseases. So generally, it is a health science. It is a health sector that determines a person with passion to help the community in that. Then now, she was also talking about what are the better subjects that you're supposed to do to put you in a better place to do either a diploma or a degree course. First of all, we'll take the scenario of Kenya. it is very important to know the subject combination, because given that it's a health science, so it will call for 4 main subjects in Kenya. But if you diverse a little bit, maths also come in. But generally, we can talk of physics, we can talk of biology, we can talk chemistry and English. Remember, I'm talking about physics, biology, chemistry and English. But to some extent, to further it, or maybe to some colleges or to some courses or to some international organization, they will also call for the 5th subject, which is mathematics. And mark you, in all this, generally in Kenyan scenario or other, we have to at least attain a credit, which in Kenya we call it maybe a grade C. That one will qualify you to join any health offering science school, where you can do a diploma at that. Then you can upgrade to bachelor degree, where you can upgrade again to master's and all that. Then also, which are some of the possible colleges or some of the possible institutions that are offering nurse as a course. Generally, in my country, Kenya, I will say that all public universities, I'm very sure they have the health sciences area where you can get the nursing course as a degree or as a diploma. Then we have some other governmental institutions like maybe the KMTC. These are governmental satisfied institutions where you are certified as an institution to offer the courses in that. International wise, both of the universities, some of them you can Google. We have a lot of universities, a lot of learning institutions that offer that. So once you have the prominent grades and you have that passion, you cannot miss a school where you are going to study that. Then also, that's now according to Kenyan University Organization or the placement universities, the cut point they talk of the C. C is around, let's talk about maybe 45% to around 60% there. Once you have that grade, at least you are able to do what? To take a course in that health sciences, which is nursing. So please don't lose hope. When you do the subject combination, those who are in Form 1, Form 2, and you are eyeing to do that, please make sure that your subject combination is that. Work hard on maths, work hard in physics, work hard in chemistry, and then additionally maths. Make sure that combination, at least you have a general C as a grade, and each and every individual subject you have to do that. English is coming in because we are looking at the international level where English is the most paramount language that at least you have to communicate through. Other languages you can do as the time goes by, but majorly please make sure you pass in English at that O level of yours. Now, which is the highest level of nursing that somebody can attain? As I told you before, this is a course that is diverse and you can expound on it as the time goes by. So majorly as per now, it is a doctorate level. Those who are looking at to be like nursing in teaching nurses, we have nurses that are specialists in teaching. We have nurses that are specialists in maybe research. We have nurses that are eyeing the managerial positions. You can further your education from diploma course to first degree, to second degree, to master's level, and then to the doctorate level. So the highest level of nursing course you can achieve is the doctorate level. So never give up. It's still a course with better opportunities. Let's go ahead and see. Topping zero, we have talked about people. So just like I told you, very first I want to take you through the types of nurses, the classification of nurses that you can learn. As you go there, you must know what type of a nurse are you going to be. Just like a doctor, we have doctors who deal with bones, we have doctors who deal with heart, we have doctors who deal with maybe blood circulation, we have who deal with the surgeries and all that, different types of medical areas. The same also, we have different classes or different types of nurses that you can undertake. There are so many, but majorly I'm going to talk about 12. Why 12? Because these are the top most placed nurse courses or the top most placed paying. We talk of payment, paying nurses that at least as you go to school or as you sit by, you can think of it. And again, this one also goes to those who did other courses. Time is not late. There's no age limit. There's no time limit. You can even still diverge from whatever you did to this course. You start from diploma level or certificate level, then you grow up to where you want. Especially those who get chance to go to other countries apart from our African countries, nurses are doing well. in these other countries, and is the soft spot of employment. According to World Health Organization, their target by 2031 or 2030, in short, in general, they are eyeing to increase the employment of nurses only by 6%. So that one can tell you this is a job market well open for each and everybody who is hearty. But don't just do nursing because you are eyeing for payment. We say that everything you do in this life must begin by why. If your why is a passion, you want to change lives, you want to save lives, you want to protect people, you want to learn to educate people about emerging diseases and how to protect yourself and how to stop them, nurse is the best way. It's all about nursing. Nursing is all about caregiving. If you're not a good caregiver, you don't have heart of removing feces from the sick people, and dealing with sick people, I'm telling you, it's not like a drive in and drive out the way you like. These people are people who are desperate, they are people who are in pain, they are people who are given up in life. Some of them even don't know their family members, so they are always arrogant. Sometimes they are very cruel, sometimes they don't appreciate the little offer you are offering them. So if you are a nurse who is not having that heartfelt, someone who is not patient, someone who is not human enough, I'm telling you, you will get it a hard task. So it is a course that is well paying, market is wide, but it is not meant for each and every person. Let's see some of the top paying nurse courses that you can undertake. But again, you have to stay with me, because after this presentation of the introduction in nurse courses, we will be handling each and every type of nurse as an episode. Meaning that in this 12, we still have a series of 12 episodes following. So keep by me and make sure you follow all my episodes every Tuesday, so that you catch up if you want to be the best student of nursing, or you want to know the advantages and disadvantages of doing this course. I decided to do it thorough because the research I did from the questions I get. If I get a question, I take it so serious. Now, nurse number one, we have licensed practical nurse. We call it LPN, licensed practical nurse. Number two, we have the registered nurse, what they call RN. And in most cases, when you get these jobs abroad, they ask about RN. RN just means registered nurse, meaning that after your diploma, you must look for the organization of nurses, a certified organization that will license you or will register you to be a practicing nurse. Once you are registered, you are ready to go. You can search job, you can enter social media and try to get connection where you can get employed well. Then number three, we have a type of nurse that is called medisurgical nurse. We will be seeing what they're doing step by step. Then we have emergency room nurse. We have those nurses that are specifically meant for intensive care unit. Those kind of nurses is a special learning that you also do. Then we have oncology nurse. We will be seeing what type of nurse is that. Then we have nurse informatic or emotive specialist. This is a type of nurse we will see later, but it's in short while, is a type of nurse that does a lot of statistics, a lot of research, and informs about the emerging diseases, precautions to be taken. In short, they can become better educative nurses who are meant to educate or train other nurses. We have the nurse managers. These are people who are eyeing managerial position in nursing environment. Then nurse educator, like a teacher, like you can do education to teach subject in school. Also nurses, we have special nurses that are going specifically to health sciences schools just to train on how to be nurse educator. Then we have number 10, we have the nurse anesthetist. We will see what is the word or the work of the nurse anesthetist. Then nurse midwife, of course, just like the word goes, midwife means they help in giving birth. Then number 12, nurse practitioner. We will be seeing each and every one. We define, we give examples, the type of phrase they get and all that. And all these nurses, they pay. When you get job, they pay. In general, the 12 listed nurses, I am telling you, roughly per hour, they work for around 45 to around $80 per hour. And you know the maximum hours you can work per day is around 8 hours. Some areas you work overtime and all that. So it is a course that if you get the opportunity and join the environment of that practitionering or practicing the nurses, by the end of the day, you will be carrying something better home. But it still calls for the passion of doing that. Just roughly, I can say that out of these nurses, the research nurse, for example, in a year can take home around between $80,000 to around $100,000. That is yearly. So you can divide per 12 hours, per 12 months, you see how much you earn per month. Around 5,000, 6,000, going like that. The highly paid nurse as per now, according to the statistic that I did in salary.com, I do my research also. There's if you want to know the salary gauge on your career, always visit salary.com, or you do research, asking people, asking the companies the salary scale. So the salary scale that I use, the salary.com, as per now, the highly paid nurse is about the anesthesia. Those nurses that offer such kind of services, they get around $189 to $200 per month. If you divide per year, it's like they are getting around $40,000-$50,000 per month, and you can get all about that. So nurses, I will say it's paying. And in general, please stay with me and I will explain for you each and every type of nurse, what are the subject combination, which college can you join, some of the advantages of doing that specific type of nurse course, and then some possible areas that you can get work on. So thank you for staying with me. Thank you for keeping me on toes. Thank you for your comment, and thank you for your motivation. I'll be bringing for you each and every episode on each and every type nurse courses. So after this, expect the 12 good series on this nurse. I call it the best paying environment or work environment that you will be thinking of. So if you are thinking of going towards nurse area, or you are still at high school thinking to join a college of nursing, please, this is the best channel to be. Subscribe, be my partner, and please watch, comment, and make the follow-up. In case of anything, you know my contact. Subscribe and Edoma, that's my YouTube channel. Thank you so much. May God bless you. Bye bye. Until next time.